How you doing today?
Yeah, pretty good.
So we've met, you know me,
Yep.
Jai Gill.
Yep.
Nice to see you. We've gone through your medical history, and I have all that, obviously, because I know you, but I think I just want to run through some of that with you and see what's been going on over the last little bit.
Yeah, no problem.
And then talk a bit about planning and next steps.
You know, I think it's one of the few areas in medicine that is really uplifting.
It's pretty obvious that, you would do much, much better with a transplant.
I think so.
What really attracted me was, on the one hand, when you call up a patient and you're saying you're coming in for your transplant today, that's often, one of the best days they've had in a long time. And so that's really gratifying.
So you've been on dialysis since January.
Yep. Yes.
How's that going?
Correct. Yeah, it's going really well.
Although dialysis is a great therapy, transplant really is the best case scenario for most people. It gets you back to a normal quality of life. It can make people work. They can travel. They can have kids. They can do all these things that kidney failure takes away from them.
I'm just going this way.
Thank you very much.
The dominant source of organs is people who've passed away, so deceased donors. But with kidneys, we happen to be born with 2 kidneys, most of us. That does allow us to donate one of those kidneys and then sustain someone else's life. And that makes up about 1/3 of the transplants that we do.
And you want to donate a kidney to your brother, right?
Sí, yes.
The number one priority with any living donor is do no harm. Patients have to go through a number of tests. A lot of that is to make sure that people are making the right decision for themselves. So of all the people that come forward, it's 1 in 5 that end up actually going forward and donating.
No recent problems with your health or anything?
¿Usted no ha tenido problemas recientes con su salud? ¿Se ha sentido bien?
No.
The reason people don't donate varies from, often there's some medical condition that puts them at a slightly higher risk, or there's a matching issue with their recipient, so they're unable to. And other people are still contemplating and deciding, and they need that information.
I'd like to this week finish all the testing. And then we can tell you if everything looks okay or not.
Okay.
They've gone through a very extensive vetting process. The byproduct of that is you get a kidney of exceptional quality. Those kidneys tend to last longer. So that's why we prefer that, obviously, is from an outcome standpoint.
Any other questions from you at all?
No.
Okay.
We have this fortune to deal with people who come forward to say, I want to donate one of my kidneys. You don't see that level of humanity in day-to-day life so much. So it's really quite nice, right? And it really is uplifting to see that.